Hey, good afternoon. Thank you all for being here. We'll get you additional information. So for today's update, we want to make a couple of announcements. So today, the Department of Health is reporting 2 new cases of COVID-19. The new cases are in Pearl River County and in Monroe County. Pearl River County now has a total of 2 cases. One of the previous Pearl River County was actually Hancock, so there's a Hancock County case now as well over the weekend. The 10 cases are as follows: 2 in Topeka County, 3 in Forest County, 1 in Hancock County, 2 in Hinds County, 1 in LaFleur, 1 in Monroe, 2 in Pearl River County, bringing the total number of cases to 12. We have tested 289 patients. Right now, Mississippi is experiencing low-level community transmission, most likely, and we're monitoring that very closely. Of course, this can change very quickly. We certainly will let you know if we have any additional spread. There's a few things we want to mention as far as recommendations. As you're aware, the President made a new recommendation just this afternoon about decreasing crowd size to 10. So right now it's recommended that people not congregate in crowds of more than 10 people. And for those who are over 65 or have chronic medical conditions, it's especially important for them to avoid crowds given the susceptibility to severe outcomes. At this time, we are not making recommendations to close bars or restaurants. Certainly it is under additional consideration, but making no such recommendation. And schools and businesses will have to continue monitoring with their same considerations. At present, schools are closed through the rest of this week. Additional considerations are being made. We're consulting closely with the governor's office for them to make an informed decision. But at this time, there's been no decision made to extend school closures past this week. In regard to the labs, the lab is getting our results out in 24 hours or less, and we are running samples every day of the week, including weekends, and accepting samples every day of the week. We hope to have the latest test results posted every morning on the Department of Health website and through our app and social media. As far as additional recommendations, we are urging and recommending that clinics cancel unnecessary or non-essential clinic visits. So from an outpatient basis, recommending if it's not an absolute necessity for someone to come into the medical environment, to delay that for a future date. We are also strongly recommending that facilities such as surgery centers and hospitals delay elective surgeries. Obviously, people are going to need urgent medical care. We need to focus on those individuals, but elective procedures need to be delayed at this time. The State Department of Health is collecting samples from providers to send them to the State Department of Health for testing, but please let the public know that you cannot come to the county health department to get tested for COVID-19. You need to see your physician, your provider, to get assessed. As we mentioned before, there were 289 tests. 12 of those were positive for COVID-19. The rest of them had something else. Most of the respiratory illness out there in the community is not COVID-19, and people need appropriate medical care. In the future, we are working with different partners in the community, different clinical entities and hospitals to support fast-track clinics in different locations. So we encourage people in the community to look for locations where people can seek rapid and efficient testing and assessment for respiratory infections and COVID-19, such that we can meet their needs in a more efficient manner. So we know that's been an issue where people are wanting to go get assessed and tested, and that's something we're going to have increased availability for. And also we are working closely with NEMA and National Guard partners looking at options for even doing pod sites where we can do rapid throughput testing to augment the needs where they're not met by the clinical community. Just as a reminder, it's important to maintain our core function, our core principles of prevention, social distancing where we can, and also to maintaining strict hand hygiene. But also, most importantly, is please, if you're ill and you're not feeling well, have fever, please don't go to work. Stay home and protect your coworkers. And at school or any other environment, please stay away if you're ill. And that's all that I have at this time. And I don't know, are we going to do the questions?
Yes, Scott, go ahead.
Do we want to swing back to see what the governor's got going on?
Oh.
We're good? Okay, great, very good.
I have a couple of questions. The Medical Licensure Board yesterday fast-tracked telemedicine. How can that work? Some facilities are not set up for the visual teleconferencing. I assume that's what you mean by getting them to go through those clinics.
Well, it could be one of different things. There's a lot of different models people look at. Now, as far as the telehealth changes that were implemented by Board of Medical Licensure, mostly what it does is well, there's several things. One of the things it allows out-of-state physicians. So, like if you had a doctor in Oshner, it would allow them to access you now at home and not have to go through licensure requirements. So basically, it eases patients' access to their physicians using telehealth. Now, it doesn't advance the access to telehealth technology. Different clinics have, like UMC obviously has advanced capabilities, and they'll be able to assess people at the home using mobile technology, which is the main thing we're talking about, so people can get assessments at their home. But some of the models for the fast track clinics, it may well be anything from using telehealth to do triage and see if you can meet the needs through the phone. And if they need to come in either to like a normal traditional clinical setting where they actually have people who are equipped with the proper protective equipment and the proper throughputs to minimize exposure and make sure that testing can be accomplished efficiently if necessary, and then they can get the people taken care of in a systematic way. Other things that are being entertained in the clinical environment is actually having drive-through medical clinics. Now, these aren't drive-through screenings where people can just come. Only people who need to be tested are people who are ill. But that would be basically accomplishing clinical care and diagnostics in a drive-through clinic setting. But these are some of the things that are coming. We don't have full view of where all these are. We're collecting the information right now. We'll try to share it with the public as soon as we have that visibility.
Courtney?
Out of that 289, have all of those tests been returned or the results of that, or do you have a rough percentage of how many might still be outstanding?
No, they've all been resulted out there. We have had a little bit of an issue getting results back to providers. A lot of them have gone to fax machines that they didn't know where they're going because that's where they were registered with our lab. The other issue has been we have a web portal where everybody can look at results, and there's been a little bit of misunderstanding on the part of how do you access that, so we're working through those problems. We have been obviously working the positives very aggressively and try to work out systems where the negatives can get there just as fast as the positives do.
And what's the processing number per day? Remind us of that.
Well, we can do up to almost 200 a day. It just varies because it's actually a labor-intensive process. It's not like you just take a thing and you stick it in a machine and you run it. You have to do a lot of process. It takes hours to kind of work through the process. So it varies based on several factors when you get it in the day and that sort of thing. But you know, it's going to be in the order of magnitude about 200, probably a little bit less.
Are there more in the pipeline?
Scott, hold on a second. Let's let Ashley go.
Dr. Dodd, so how many ventilators, respirators, or even ICU beds do we have in the state? I mean, I understand it may be low level now in terms of transmission, but as we continue to see this spread, will we have enough to take care of people if they need to be hospitalized?
Sure, no, that's a great consideration and one that we've been looking at. We do have visibility of by part of the state how many beds are open, whether it's going to be an intensive care unit or whether it's a negative pressure room for like isolation. You know, we have hundreds of negative pressure rooms that we have access to. We're at baseline utilization essentially for this time of year, so we don't have any increased demand on our ICU beds. It's hard to give you an exact number. It changes a lot, and certainly we want to be careful about making people worry because you know you can have one bed available now and 5 available in the next 3 hours based on patient flux. But it looks like right now that we have pretty steady level. But a lot of the ICUs in the Jackson area, they run pretty full. And so it's something that we're watching very closely. But we do have capacity for backup ventilators and such things if we had to get to that.
I wanted to ask you back to the question about the types of testing. If 200 a day is what you can average on testing, how many are in the pipeline? How many do you have to still get to? Is it possible to put up?
Every day we get them, we're getting them out. There's no backup. That's all the ones we've got.
Candace, go ahead.
Yeah.
Just to clarify with those tests, the 289, is that tests that have gone through the Department of Health, or does that include commercial labs as well?
Well, that's the ones that have gone through the Department of Health. We're still waiting on our reports from commercial labs. They are going to report to us not only positive results but negative results. It's actually legal mandate that if there is a positive case that they report it to us. Also, we have interstate agreements in this sort of thing, as you can imagine, where other states report cases to us. So we do have visibility not only of the stuff that we test here, but also the stuff in other states. It's a network that's existed for a long time, and also stuff that comes from commercial guys.
Okay, we'll take this over here, Thomas.
Sir, I apologize for making you repeat yourself, but could you just specify again how many total cases we have in Mississippi and where they're located, just how you're monitoring them?
Yes, sure. So how many cases do we have in Mississippi? We have 12 cases in Mississippi. We have 2 in Copiah, 3 in Forest, 1 in Hancock, 2 in Hines, 1 in Monroe, 2 in Pearl River, again for a total of 12 cases. When we have a case, what we do is we send a disease investigation team, and we put them on it, they figure out how long they've been ill, how long they might have been contagious, identify people who might have been exposed, and then of those people exposed, put them on quarantine. Now, as far as quarantine is an important word to understand, quarantine is basically someone who's exposed but well, and they're just chilling out of the house. And so that means, that's what quarantine means. It's a healthy person who we're monitoring. If someone's ill and potentially contagious, that's isolation, and we'll keep them on isolation as long as they're contagious.
Have the 2 new cases, have they been hospitalized or they self-isolated?
We're not reporting the hospitalized anymore, just because of the specific identification of individuals we faced. But we have not had any deaths so far.
Will you keep reporting on folks who are over the age of 65?
We're not going to report age anymore.
Ashley, go ahead. Go ahead.
Really quickly, in terms of health care workers and health care providers, do we have enough personal protective gear for them, or where are we in terms of that?
Yeah, so that's a good question. It's a matter of where we need it, right? And so we do have stocks available for high-risk areas. So if someone has an active case, we will deploy appropriate protective gear to those individuals so that we don't deplete our resources in places where they're not needed. We do have adequate stocks to deploy to areas with positive tests so that we can protect those healthcare workers in the event of illness.
Can you provide some more detail on what you refer to as this being a low-level exposure type situation right now?
Yeah, so basically what that means is, when we think about it, if we have a traveler come in, right, an isolated person, that's not going to be immediate transmission was important. But some of these cases do not have clear identified risk of getting it from, like traveling from Europe or somewhere else. So we think they probably caught it from somewhere else in the community.
Thomas, would you get this gentleman, please?
Yes, sir. Yes, sir.
Robert Jackson, State Senate. What's your advice to our state legislature in regards to this contagious virus? We have 174 members coming from all over the state of Mississippi. What's your advice to the state legislature in regards to this?
They've been very engaging with this. They did look at limiting visitors, right? So that there's not so many groups of people in there to protect not only themselves, but also the public, from getting together. The recommendations for groups doesn't really apply to places of work and schools necessarily, and certainly even within a business, you don't want to congregate too much. That's something that they're discussing, and certainly I wouldn't want to speak for them. But I know they're very engaged in the conversation.
Dr. Dobbs, roundabout.
Yes, sir.
Could you talk a little more about the drive-by clinic, drive-by testing possibility? How close again are we to having that?
So the questions about drive-by clinics, those are already in the works from private clinics, right? So they're wanting to put those together, and they're operating to some degree these fast-track clinics now. I don't have clarity on exactly the process in which areas, but it's been a practice we've been encouraging. We're working diligently to get a full and complete list of what's available where. But in addition to that, with support of the National Guard, and FEMA had asked what our needs might be, putting out basically rapidly deployable fast-track drive-through clinics if we need to, especially in the event of an area or county that has a special need. We can go in there and do some rapid fire testing.
Again, that's for sick people, not for people that need testing.
Right. So the only people who need testing are sick people. There's no benefit to there's no identified benefit of just screening people who are asymptomatic. If you screen somebody who's asymptomatic, they might be symptomatic tomorrow, even if they're negative today. So it could be very misleading.
Last question.
As to the
Ashley?
restaurant's possibility, because we're at low level, is that why we don't
That's your
think we
question.
need to move to the restaurant reductions in dining rooms or anything like that?
This is an ongoing conversation. We just haven't, I haven't given that advice to the governor, and the governor and his staff have not come to that conclusion.
Thank you, everyone. Appreciate you coming. And remember to check our website at healthyms.com for all the latest information. You'll see it first on our website, so be sure, and we're trying to update that every morning, and also remind people to download the Mississippi Ready app, because it has information on there as well.
And real quickly, Governor Reeves will be live streaming his message at 3:30 on Facebook and Twitter. So please dial in and see him on Facebook and Twitter. Thank you all very much for being here.
Thank you.